Hello, good evening, everyone. I'm Yezaz Ghouri. I'm one of the assistant professor of medicine at the University of Missouri, Columbia, Missouri School of Medicine, and from the Department of GI and Hepatology. And I'm here to talk about IBD care in our college students. This is my disclaimer, just to let you know I'm not getting paid for this, and I love to do this volunteer work. And these will be the topics, kind of an overview of what we'll be covering today. So kind of before we get started, a little bit about what inflammatory bowel disease is. I'm sure as you know, it's a chronic inflammatory condition of your bowels. Usually is of two types, ulcerative colitis and Crohn's disease. And in certain situations, we're not able to tell which of the two it is. Is it ulcerative colitis or UC or Crohn's disease or CD? And in that case, we call it indeterminate colitis. Almost more than 50% of the patients, when they have indeterminate colitis, after 1 year, they usually end up with the diagnosis of either UC or Crohn's. It's just a matter of time of figuring out what it is. And why is it important to talk about these things in our ever-growing population of IBD in general United States? I mean, we have close to about 1.5 million patients with IBD in the US, and they say the incidence rate among younger population is increasing. Close to about 10,000 per year is the prevalence of newly added IBD patients who are younger. So before we kind of dive into all the major topics, what are we going to sort of stress on over here for you guys as college kids would be, first, take your medications on time and as prescribed. Visit your GI doctor every 3 to 6 months or whatever is recommended according to your GI specialist. Eat healthy. That means eating more salads, more fruits, and less of red meat possible. And avoid the pizza and hamburger diet. The fast food is the easy option, but is not the healthy option. I mean, it's the obvious fact, but when day-to-day life gets hard to keep up with trying to cook healthy and things like that. So it's important to sort of limit red meat, deep fried food, fries, and foods of that sort. So coming to this issue of when do you see a GI doctor? What is the need for me to see a GI doctor? I have a GI doctor back in my hometown. Why should I get to see a new doctor here in the town where you moved to for your college or what have you? It is very pertinent, very important. First of all, just making sure you seeing your doctor regularly prevents you from getting hospitalized, having any kind of complications, decreases the rates of having flares or the need for change of therapy or getting on steroids. And most of you or whoever have had IBD and have experienced steroids, it's not a good feeling. Getting on steroids gives a lot of side effects. So to prevent all these things, and of course the risk of undergoing surgery if your disease goes out of control. So to prevent these things, follow up, it's not just to adjust your medications, it's also to get your routine labs done, because some of the medications you might be on cause your immunity to be suppressed. So you want to make sure that those immune cells are not really low, your liver is not getting damaged from the treatment you're on, your kidneys not getting damaged, so things like that. That apart from frequent immunization or what have you that you need. So all these things can be addressed when you see your doctor regularly. It's important to also see your doctor when you're losing response to treatment. Sometimes, say someone's on Humira or Entyvio, and closer to the time of their shot or infusion, they start feeling their symptoms are coming back. So that is a sign that you're losing response to the drug. So it's important to change the dose of the drug, the frequency in which you take the drug, or completely start a new form of therapy. So that is important also during flares, and we'll talk about what entails a flare. Also, like I mentioned, when you're in a new city or town, always important to find a local GI specialist. Make sure you establish care. Why is it also important is because in case you end up with a flare and you show up in the hospital or in the ER, and you want a new GI doctor to see you there in the ER and hospital, they have no clue who you are, what you've undergone, what treatments you've had. So because of that, you kind of want to have an established GI specialist. So in case you end up in the hospital, someone who you've seen before, a known face comes in and sees you. Okay. Also, prior to any kind of planned surgery, it's always important to make sure that your medications are optimized. If you develop new symptoms like skin rashes, you develop any kind of mouth sores, weight loss, change in vision, red eyes, or what have you, because these are all signs that extra-intestinal, meaning not your GI related, but extra GI symptoms of IBD. So we're kind of recognizing them early and making sure that it's under control. Also, when you develop new diseases like thyroid disease, neurological conditions, any kind of B12 deficiency, lupus, rheumatoid arthritis, lung-related issues, these are all extra GI-related diseases that are associated with IBD. So someone with IBD is high risk for developing, say, MS or rheumatoid arthritis or lupus. So if you develop any of this, also means that maybe your IBD is also going out of control. And how do you recognize a flare? Simple symptoms like abdominal pain to cramping to diarrhea to passing blood to severe nausea, vomiting, fevers, and all these things do count as flare symptoms of IBD. So transitioning from IBD pediatric GI specialist to a adult GI specialist. This is very important, especially in an age group of 16 to 20. This is sort of the age group where pediatric GI specialists will sometimes continue to follow you. At the same time, there's a new face, your adult GI specialist who's going to see you. Once you turn 18, you are a legal decision maker. At the end of the day, your parents may give you an opinion, your legal guardian may give you an opinion, but at the end of the day, I as a physician, I'm going to look up to you. I'm going to ask you, what do you want to do? These are your treatment options. This is how I want to approach this. Are you okay with this? Because you are the ultimate decision maker here. Because until this point of time, it was probably your parents or legal guardians who were holding your hand and helping you make decisions, or maybe making decisions for you. So it is important that you know what's going on in your own body. What type of disease do you have? Do you have ulcerative colitis, Crohn's, or is it indeterminate colitis or what have you? Have you had any surgeries? And if so, what type of surgery was it? Have you had any treatments given in the past? What type of treatments were they? Have you had any reactions to any of those treatments? What kind of reaction was it? Were you switched to any other treatment? And if so, when was it done? Have you had any complications from your disease itself? When was your last flare and how was it managed? Were you given steroids to manage it? Were you given Remicade or what have you? So all these things, if you know yourself, when you come to see your adult GI specialist, the GI specialist and you can make an informed decision instead of sort of a blinded or semi-blinded decision. And last but not the least, and as a pediatric GI specialist walks in, they are excellent in managing pediatric GI-related disorders. But it also, there's a limitation with pediatric GI related treatments is that not all the treatments are approved by FDA for use in pediatric population. So an adult GI specialist may have that extra list of drugs in their available list that we can use and we are comfortable using because we use this all the time. So that's the other advantage of seeing an adult GI specialist. Not to say that Dr. Mittal here doesn't do an excellent job. So we'll talk a little bit about diet in IBD. It is very important to talk about diet, and this is a very core part of my clinical visit. Any patient who comes to me knows that I will spend at least a few minutes talking about what they eat, how they eat, should they eat this or the other, what are they supplementing themselves with. So because diet directly affects your bowel, because this is a condition of the bowels. And this is something that you as a patient can control. This is not something I as a physician or your nurse or anyone else can control. This is you completely who is in 100% control of what you put down your mouth. So what should you be doing? Eat a lot of vegetables, a lot of fruits, right? More salads if you can. Eat the rainbow. That's an easy way to remember. The more the variety of colors you have on your plate, the better. Because the more the colors means the more different type of antioxidants you're getting. Antioxidants are basically anti-inflammatory molecules present in fresh fruits and salads, especially the ones that are more colorful. These decrease anti-inflammatory, so they decrease inflammatory bowel disease-related, inflammation in your gut. Not just that, also IBD puts you at higher risk for developing colon cancer. Not everyone sort of thinks about it. I mean, I'm still young. How can I get colon cancer? Well, if you have IBD, your risk of colon cancer shoots up drastically compared to an average population person. So what do we suggest? Patients who are older, who are at risk for developing colon cancer, if they've had polyps and things, we tell them eat more fruits and vegetables. So I tell the same thing to you guys. Start eating more fruits and vegetables because it also has anti-cancer, anti-aging, anti-inflammatory properties. It's a big deal. It really helps. So vegetables usually are good, except during flares. I do suggest that my patients eat well-cooked vegetables because sometimes when you're flaring and you take fresh salads, broccoli and whatnot, they can give you worsening symptoms. They can give you more diarrhea. So make sure they're well-cooked. That's only during flares, but in general, you can eat them fresh, no problem. What kind of protein do you need in your body? That's another important aspect. So red meat is generally a no-no because red meat, the way it has more fats, the kind of fats that you don't digest easily. So prefer the white meat if possible. Chicken, fish, usually an excellent source. Eggs, they're always good, especially the egg white part of the egg is actually very, very healthy. It has very simple protein, very easily absorbable. 1 to 2 eggs a day, not a problem. You can add extra egg white if you want. Grass-fed animals, generally healthier because they don't have a lot of antibiotics or hormones in them. Fish, what kind of fish do people ask? I mean, usually tuna, halibut, salmon, sardines, these are all pretty good. They have low mercury levels, so that's a good thing. They have high omega-3 fatty acids, which are the good fats that you need in your body. Talking about dairy, this includes, by the way, not just milk, but also ice cream, which we all love, but it is a part of dairy, okay? Cream cheese, what have you. So milk, just what is it made of? To sort of give you a perspective of what I'm going to talk about here. Milk is made up of course, the milk carbohydrate or the milk sugar lactose, the milk protein casein and whey, the milk mineral, which is calcium, which is good for you, and the vitamins, very important, vitamin D, we all hear about it. Also vitamin E, vitamin A as well, and B. So the fat content in the milk is about 3.4% in whole milk for the ones who try to watch their weight, and it's about 1% in low-fat milk. But what's tricky is some patients with IBD can also have what is called as lactose intolerance. Two different things. Lactose intolerance is different from lactose or milk allergy. Milk allergy usually is identified at a very, very young age, as when you're a child or an infant, because that's a different presentation altogether. Most of the adults are younger adults who present with inability to tolerate milk. It's usually lactose intolerance. And it's interesting that, the number of patients who have lactose intolerance is higher if you have IBD. In ulcerative colitis, it's about 28%, and Crohn's disease is actually 35%. It's much higher than the average population incidence of lactose intolerance, which is about 8%-ish, somewhere around there. So identifying that you have lactose intolerance that's giving you diarrhea, cramping, abdominal pain, or what have you, it's important to differentiate that from your routine IBD flare. So if you're having IBD flare on top of that, you're having some lactose intolerance, you avoid the lactose intolerance. But it's tricky when you don't have any IBD going on, but you're having diarrhea and it's coming from lactose intolerance. So talk to your GI specialist, figure out what's going on. Usually there is underlying lactose intolerance that can be addressed. You don't need any new medications for that. And by the way, yogurt, although is a milk product, it contains good bacteria in it. So even if you have some amount of lactose intolerance, people usually do well with yogurt. Some other protein sources, grains and legumes, brown rice, quinoa, oatmeal are pretty good. Legumes are a good source of protein, fiber, vitamins, minerals. Soy and wheat are sort of like in one of those two sort of grains that I tell my patients to be a little bit more careful about. Most of the patients end up having diarrhea when they take it, especially during flares. So during flares, I say stay away from soy-based products, which includes tofu, by the way, and also wheat-based products. Fiber is generally good for you. Fiber is actually like the good stuff that the colon needs to stay healthy. It's recommended to take about 20 to 35 grams of fiber a day, but most of the people usually end up doing about 15 grams a day. In general, fiber is good, but also remember there's two types of fiber. There's something called insoluble fiber and the soluble fiber. The insoluble fiber sort of consists mainly of like green leafy vegetables, root vegetables, which even includes potato fries or French fries, fruit skins, and corn. It's fine to take even the insoluble fiber. There's nothing wrong with that. But when you're having sort of your flares or you feel like your disease is not under control, I suggest you switch to more of a soluble fiber, which is more like oatmeal, citrus fruits, apple, barley, rice, beans, lentils, psyllium, things like that. Especially, and also if you have like a Crohn's disease with like a stricture, or you've had surgeries and most of your bowel has been removed, I generally recommend stay away from insoluble fiber. And that's sort of, and if you Google, you'll probably find a list of, PDF lists after lists about what is soluble and insoluble fiber. So in case you don't know what it is, you can just run through that list. Fats and oils, olive oil is good for you. We all know that. Fish oils, good. Coconut oil, nuts, seeds, avocados, generally good. The bad fats and oils, margarine, canola, corn, soybean oil, vegetable oil. Why are they bad? Because they have trans fats, GMO, and usually contain omega-6 fatty acids. Also, there's not a lot of oils that contain hydrogenated oils, but if there is any, that's actually bad for you. It's bad for you for your heart in general and things like that. Keeping yourself hydrated is also very important during your flares. Make sure you drink plenty of water. Drinks like Gatorade or what have some energy drinks are fine too, of those kind of electrolyte drinks. I wouldn't say energy drinks, more like electrolyte drinks are good for you too. It's not a problem. Also, filtered bottled water is fine. Eliminate sodas. So I've had patients who've absolutely stopped sodas, both diet and regular soda. I'm referring to both. Completely stopped, and they say, I don't need any more treatment because I feel so good. They've just stopped sodas and it feels so good. So it's really the kind of stuff that I put in, these products is really, really horrible, to say the least. And most of them contain what is called as fructose corn syrup. And if you know what it is, it's not good for you. It not just hurts your bowels, but also increases risk for heart attacks, diabetes, high cholesterol, strokes, and what have you in the future. So something to be careful about. Sucrose or sugar in general, try to avoid. Also, artificial sweeteners can actually be damaging as well. They give you something called an osmotic diarrhea, which just worsens your IBD symptoms. Although stevia is something that I do recommend sometimes. It's fine because it's kind of plant-derived. And this is a sort of a little trick that I suggest my patients during flare is to start doing smoothies. Froyo is one of them, which is easy to get, but also, just make your own smoothie. Put some frozen or fresh vegetables, fruits. You can add some protein to it, like whey or plant-based proteins, and also you add some yogurt to increase your protein intake. So especially during flares, I just tell my patients to get on sort of a smoothie diet. So smoothies 3 times a day. You can add a little bit of boost to it if you want. This will make sure you'll get enough calories and proteins that you need. And of course, these have tons of vitamins and minerals in it. And IBD causes a lot of these minerals and vitamins to be lost or not absorbed. So this is a good source to sort of get them back in your system. So broadly speaking, foods to avoid: sugary things in general, dairy, wheat, non-absorbable sugars like we talked about, all forms of like sugar, sugar-free candies, ice cream can also make your flares worse. Also fruit juices that we get in grocery stores, not always containing things that are good for you. Saturated fats like hamburgers and things, pizzas and fries, trans fats containing foods, spicy foods. Sometimes Chinese food can give you more flares and doesn't really help. So during flare stuff, you just take care of your diet, go to a more of a simple diet, and that'll help you along the way. And people ask me about the low FODMAP diet. I call it the impossible diet. I mean, if you look at the things that are listed there, I mean, I cannot even do this for a day. Although ice cream, again, is mentioned there. It's a weak point there. It also doesn't end there. It says cheese, yogurt. I mean, think about it. Milk, there's a bunch of fruits and vegetables listed there. So it's a very unreasonable diet, in my opinion, but it works. Studies have shown that if you go on low FODMAP diet, the tendency for someone to recover out of a flare is faster. But what is more reasonable? What is more acceptable? That's where the semi-vegetarian diet comes into play. And that's what I tell sort of my patients to follow. This is more reasonable. Most of my patients feel that this is something that you could reasonably follow. Switch to more white meat instead of red meat. You can take egg white. That's good for you. More fruits, more vegetables, minimize processed foods, and supplement with minerals and vitamins if you can. So simple things that you can do during flares, and especially when you want to keep your disease well controlled, these are all things that help. Also, the semi-vegetarian diet has been studied, and it showed that 94% of patients with Crohn's who got onto this diet had stayed in remission or controlled disease compared to 33% who were on sort of a regular diet. So almost 3 times more response. So what are the supplements that I can suggest you to take? Of course, talk to your GI, especially before starting any of these over-the-counter supplements. But in general, a multivitamin daily intake should be fine. A multivitamin. Vitamin B12 is generally good for patients who have Crohn's disease because they tend to lose their ability to absorb B12. Vitamin D supplementation is good. Vitamin D levels, if they are low, has been associated with worse flares than the patients who have had high vitamin D levels. Make sure you go out in the sun, get enough sun exposure, take enough calcium supplements along with your vitamin D supplements. Fish oils like omega-3 fatty acids. Probiotics. This is another sort of a topic that is contested. Probiotics in general don't seem to have a significant impact per se on IBD, but in ulcerative colitis, it seemed to be a little bit more helpful than Crohn's. Crohn's absolutely hasn't shown any significant benefit. Ulcerative colitis, some benefit. So yeah, if you're taking it, you can just take some yogurt instead too, and that's fine. And it's important if you're taking a probiotic that it has more species of bacteria, at least 3 species or more. And last but not the least, turmeric or curcumin. This is actually a pretty good anti-inflammatory, naturally available, food constituent. Indian foods actually have a lot of turmeric in them. And, taking about 1 gram, 2 grams a day is pretty good. And, you can supplement with your diet as well. And that has a lot of anti-inflammatory properties in it. We'll talk a little bit about mental health and IBD now. This is important to address, especially in considering the crowd I'm talking to, because you're away from your, more stable home, your parents, you don't have a whole lot of support, but still, you're getting to a new place. It can be difficult. It can be challenging. And on top of that, if you're suffering from a chronic debilitating illness like IBD, that doesn't help the whole picture. So the tendency for our patients to get depressed or even develop anxiety because of their state is not unreasonable, not unheard of. We do see a lot of patients who end up with that. And also studies have shown that patients who have mild disease, mild IBD, which is not really controlled, but still there, the risk of mental illness is about 27%. If the disease is worse, it's almost half of them end up having some sort of anxiety or depression. This compared to almost only 10% in the general population. So it just goes to show, if your disease is not under control, you're going to have higher risk of developing psychiatric illnesses. If your disease is controlled, the rate has dropped. Studies show it's about 11%, almost close to what the general population incidences. So pay attention to your mental health. Don't, feel shy or afraid to talk about it. It's okay. This is very expected. This is not unheard of. We come across these kind of situations a lot. And bring it up every time. If you have any of these questions, bring it up with your primary care doctor or your GI specialist. There are several screening tools that the GI specialists and PCPs or primary care physicians use to make sure that you don't have any of these psychiatric conditions or development or early stages of these psychiatric conditions. Also, treating these psychiatric illnesses actually decreases your incidence of developing more flares. So they're both connected. IBD flaring can cause psychiatric illnesses, and badly controlled psychiatric illnesses can worsen your IBD. So kind of need to address both. I thought this was kind of the 13 reason why list. You may be having depression. No pun intended. But this is a simple list that I ask my patients. Do you have any of this or you don't have any of this? There's a certain number in my mind. When I have more than that number, I say, okay, fine. You need to be on some sort of treatment because you may have this or you may have that. Things like interest in daily activities, feeling depressed or hopeless, how's your sleep, too much or too less, feeling tired all the time or lack of energy, poor appetite or eating too much, you feel bad about yourself, you feel like you've let down yourself or your family members or someone close to you, trouble concentrating in class or in other activities, speaking or moving slowly or being too fidgety, thoughts of hurting yourself or committing suicide, and last but not the least, even if you can't put a finger on it, but you feel like something is off, just bring it up, just talk about it, okay? And this ties into also what is the incidence of fatigue in IBD. About 50% of patients, when they come in with the new diagnosis of IBD, tend to have fatigue. They also complain of fatigue. But it's interesting the way this fatigue symptom comes about. They're always tired all the time, but their disease may not be poorly controlled, but they have the disease. So fatigue, very interestingly, can be caused not just by the disease itself, but also the treatment that we use for the disease. So sometimes you get started on Humira. The first 2 months, it's like, I can't get out of the bed when I take a Humira shot. I'm not able to do anything. I can't play soccer anymore. But eventually the body gets accustomed to it. There's a phase, and eventually the body figures out a way to work around it, and your energy levels will come back. So be a little patient with the medications. When IBD goes out of control, your fatigue comes back. So that's something to be addressed. And studies have shown that when you have a group support therapy, the incidence rates of fatigue go down. Your fatigue improves. You talk about it and you address your condition. You address what exactly is going on in your body. The fatigue rates have shown to be improved, along with depression scores. So we'll talk more about group therapy as we go on. There's a whole sort of slides on that. Smoking in IBD, I think this is my brand of cigarettes. Smoking disables you before it kills you brand. People think that they smoke, oh yeah, I'm going to die early. No, you don't die. You're not going to die from smoking. You're going to lose a limb. You're going to be dependent on someone. You're not going to be able to move about. Your lungs are going to function at 25%, and you will be on a wheelchair before you die after a decade living like that. It's a miserable life before it takes your life. So for the ones who are smoking, it's really bad for you. And this, I'm not even getting to the IBD part, and we'll talk about the IBD part. Cigarette smoking, hands down, is associated with Crohn's disease. There's no question about that. If you have Crohn's disease and you're smoking, God help you. Because any treatment you give, it may not be able to achieve 100% control. And there have been times when patients complain about, oh, why is my disease not under control? They're on maximum doses of really strong therapies like Remicade and what have you. It's because they're lighting up cigarettes when they walk out of my clinic. So that's just not acceptable. So if you have Crohn's, do not smoke. It's really bad for you. But that includes even for passive smoking as well. So be aware of your environment. But there's this interesting concept about ulcerative colitis that people claim that if you stop smoking, your ulcerative colitis flares up. And that to some degree is true, but I say that with a grain of salt. We've done studies where long-term effects of smoking are studied in ulcerative colitis, and overall, it has no benefit. If people think that they smoke, they'll feel better in ulcerative colitis, that's not actually true in long-term sort of risk analysis, because your risk of cancer goes up with smoking, even colon cancer. So ulcerative colitis puts you at risk of cancer. Smoking will further 10 times increase that risk. So overall, that's not good for you. And, also people nowadays want to vape, and, it's not good. It's pretty obvious that it's not good, but, is there any data to say, am I saying this based on some data? No, absolutely. There's no data to prove or disprove that vaping is better than smoking, or I thought that's a line on an ad too. But it's not considered safe. So the general consensus is even vaping is not good for you. And now some states have started banning vaping too. Alcohol use in IBD. Well, the biggest issue with alcohol, of course, it'll cause diarrhea and give you more fatigue and make you feel like, the word. So avoid it if you can, but also be aware of certain things that alcohol does. Of course, alcohol causes liver damage. You may consider yourself young and healthy. Well, my liver's at 120%. Well, is it so? You've got IBD. Are you on any medications that can also damage your liver? In that case, taking alcohol is bad news. What are these medications? Methotrexate, 6-mercaptopurine, or 6-MP, azathioprine, or Imuran, tafastinib, which is a newer drug, or Xeljanz. These are drugs that can also cause injury to your liver. So if you're taking alcohol on top of that, you're asking for trouble. Last but not the least, there's another medication called metronidazole oral flagyl. It's a commonly given antibiotic to patients who have IBD and they flare in between sometimes. If you take alcohol with it, it's going to give a severe reaction, like antabuse-like reaction. And antabuse is a drug, or disulfiram is a drug that we use for chronic alcoholics who want to quit drinking alcohol. Because if you drink alcohol on top of flagyl, it's going to feel like you're going to die. The chest closing and palpitation, it's a horrible feeling. So please do not mix the two. Ulcerative colitis is associated with this condition called PSC, primary sclerosing cholangitis. What it basically is a scarring condition of the liver that can damage the liver. So if you take alcohol on top of that, you're just making the job easier for your liver to be scarred out. And lastly, dehydration is a risk with alcohol use, and ulcerative colitis is associated with a lot of dehydration risk, and that can cause muscle injury, kidney injury. So make sure you're keeping yourself hydrated enough. If you do, drink some alcohol. Cannabis and CBD oil, interesting topic. So this is something, this came out of public demand, this particular slide. So first of all, before we get into it, drugs are bad for you, duh. And there's cannabis, because obviously people think that cannabis is not really drug, but some people differ. But yes, drugs are bad for you. I don't have to mention any further beyond that. But talking about cannabis or marijuana per se, there's really no large-scale data or a high-quality clinical study that shows that it's good for you or it's bad for you. People use it. They say that feels good and you feel better, the symptoms go away. But really speaking, there's really no benefit on the disease itself. That is something that we're clear on. If you smoke cannabis and you think that your disease is going to get better, that's not true. That doesn't happen. Will your symptoms get better? Maybe. Are there studies to prove or disprove that? No. So really, we don't know. That's the best answer. And this is true even for CBD oil as well. And also remember the legal implications for cannabis use. I mean, it may be fine here. You go to Texas, that's a different story. So again, be careful with state what you're doing. We'll talk a little bit about the help center that we have here. We have trained specialists from the Crohn's Colitis Foundation who are ready to help you. There's 170 languages in which they can help you talk about your problems. They offer support programs, related information, and here are some of the contact information that's out there for you guys. College website or campus connection. They'll There's a listed website there. Try it out. Crohn's Colitis Foundation puts in a lot of effort. Dan here, who puts in a lot of effort here in Missouri to help these things run smoothly. And yeah, so it's all there for you. Finding a support group, Power of Two. We have support groups available in Columbia, Missouri as well. In fact, we are planning on starting one for the Mizzou students itself. Hopefully we'll get that going soon. There's a link here to find a support group near you, whichever state you are in the United States. Again, it's open for not just the patients, but also your family members, friends who are taking care of you. There's an online application I believe you have to complete. Connecting with others through the community we have at large, share your problems, helps, obviously, talking to each other about what's going on, maybe learn something, maybe you feel like, world's not coming to an end. You're not alone in this fight. Definitely not alone. And the Crohn's Colitis Foundation has various sort of social media outlets through Facebook, Twitter, and what have you, and getting involved locally through our support group system. We have Dan's information there. There's a lot of fun activities that are coming about. And I think we have one coming up in Kansas City, I think October 5th, and we have one after that at Dave Buster's in St. Louis. So, and in fact, we are actually talking of doing one in Columbia, Missouri soon. So hopefully we'll get that going. All right. So thank you, everyone, for your time. And I can take some questions.
Dr. Ghouri, medical marijuana and CBD oil, it seems like so many people are using it. Why are they using it if there's no evidence that it will work?
So like I said, it makes them feel better. Of course, when people get high, it makes them feel better too. We know that's an obvious fact. But it's the symptomatic improvement because there's so-called CBD receptors located in your bowels, which have some sort of a positive effect on your symptoms. But again, like I said, very specifically, the disease part, absolutely no benefit that we know of so far. Maybe in future we'll have some data, but at this point of time, your IBD part of the disease, nothing changes if you smoke marijuana or take CBD oil. You have any other questions, Don?
Another question from the audience. Do you recommend the specific carbohydrate diet?
So this carbohydrate diet is sometimes used even in pediatric population because it's basically simple sugars, foods that are easily absorbed by your body, that don't give a lot of issues. Like if you take fats, they're the most difficult to digest per se. So it'll have more stress on your bowels to try to digest and absorb these things, versus carbohydrates, which are the most easiest forms of diet that can be absorbed. So yes, when you're flaring, like I mentioned, you get on the fruits, vegetables, smoothie diet. That's pretty much your carbohydrate diet for the most of it. It can have some amount of plant protein in it. That's fine. Most of plant protein is generally well absorbed as well. So so carbohydrate 30 diet, it does work. But yeah, it's fine as a short-term measure during a flare or when your disease is not fully controlled. But long-term, obviously, you need the good fats, you need the good proteins, you need the good minerals and the vitamins, and they come from a variety of foods.